Public health is a population-based field of science focused on preventing disease and promoting health. Every week, we will be engaging in interactive discussions and analyses of the latest public health issues affecting you and your communities all around the world. This is the Public Health Insight Podcast.
My name is LaShawn, and I'm here with Ben, Sully, Linda, and Gordon.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
In the previous episode, we looked at the global burden of road traffic deaths and injuries. The next step, after identifying a problem, is taking action. However, global and national safety goals and targets are no easy feat. This requires sustained efforts in coordination and management to tackle the systems issue of road safety. In this episode, we will look at the role of leadership and institutional management and some of the best practices that can be used to address this issue. So, why do you guys think leadership and institutional management play a role in improving road safety?
Leadership plays a role in everything, man.
Can you define institutional management?
Yeah.
Can you define it?
Is there an echo?
Forgive the technical difficulties, everyone. There's an echo that sounds different than the person that originally said it.
Let's just talk, because what do you mean by institutional management? Are you talking about like infrastructure that we mentioned before? Are you talking about government funding? Because then that plays into leadership.
I think it's a combination of all of it. Institutional management is having a strategic plan, having targets, having measurable targets for a specific goal. So in this case, it would be like having a framework for road safety that there's funding, there's targets, there's a timeline. That's a systems approach rather than isolated.
Mm-hmm.
I think it encompasses all of it.
I think you can, I'm not sure semantically you can do this, but for the purposes of our discussion, institutional could mean a cross-sectorial approach within government, right? So I think from our previous episode, we've seen that prevention efforts and, the allocation of resources and, the health systems side of things aren't really aligned. When we have a health in all policies approach, road safety should definitely benefit from that. So
Right. So it seems like in the last episode, we talked about how the UN incorporated traffic safety into the Sustainable Development Goals. Now, at the country level, whose responsibility is it to actually incorporate this and kind of take measures towards achieving some of these goals and targets?
Right. And I think that's a good point, because we talked a lot about the governments being responsible, and obviously governments would be releasing these reports or these deadlines or goals. But another aspect of it is that we also have to consider private organizations and community organizations holding the government accountable for the goals that they set themselves. So I think leadership can play in both the private and the public sector.
So in terms of the way, I guess, most countries are set up, whether it's low, middle income or, higher income countries, there is a Ministry of Transportation, which is usually a branch within, the whole government. So when roads are being built or, there's issues with road safety, I would imagine that falls under the jurisdiction of, the infrastructure parts of government or the transport branch of government. But I'm not sure how much of a role public health plays in the design of like highways or streets in urban areas or rural areas. I'm not sure how much of a cross-sectorial approach is applied to those.
So let me stop you there. So do you think public health should have a role in this?
Within Alberta, we have a Department of Injury Prevention within Alberta
Right.
Health Services. And
Right.
in injury prevention, we talk a lot about traffic safety and road safety. We give guidelines for, things like car seats, booster seats. So there's already a conversation within public health surrounding injury prevention in regards to road safety. And to me, it only makes sense that those same voices would also just be at the table in terms of urban planning, infrastructure, in regards to designing roads, because they have the same goal.
Right. And in Ontario, the health units typically have a portfolio that looks at road safety and provides kind of guidance to the local municipalities, some recommendations on how to bring down injuries and make the road safer. But I don't know how much that information is factored into decision making for the infrastructure sector, right? I don't know how much. I don't know if telling them that, there's been the rates have increased threefold since last year. I don't know how much that drives decision making into, I think everyone's seen bike lanes pop up recently, and even those barriers that now separate the car lanes from the bike lanes, I think that's helpful for in making the cyclists feel safer and some passengers feel safer. So maybe it has had an impact, but I'm not sure how much it factors in. And I think that's the heart of the discussion LaShawn was bringing up, that the institutional management of things. So the kind of getting away from that siloed approach to, you're in the Ministry of Transport, you deal with roles, public health and healthcare deals with people when they're sick or prevent them from getting sick. And how do we marry the two together for the best results?
And I guess it would depend too on who's building, if we're talking specifically about roads, who's building the road, how is it being funded? And I was looking into it and I found that in Canada, roads are funded through a mix of options. So sometimes it's through federal or national funding, other times it's provincial, and other times it's public-private partnerships. So there's not one set way. And so that would determine who's involved as well in the decision-making process.
Yeah, and I was even thinking with the goals, so the UN goals, the Sustainable Development Goals that LaShawn mentioned in our previous episode about cutting road traffic deaths by half and such and such. I'm wondering if the kind of local municipalities in Canada, for example, in the different provinces, I'm wondering if they also have those similar goals, right? When you're building sustainable cities or you're kind of making modifications to make things more bike friendly, are there goals in mind that, the reason they're doing this is to reduce the fatalities that cyclists have by X amount? I don't think we hear that very much. So I think if one thing this has taught us is, and Ben always says this too, to have things being goal driven, we don't really hear much about what those goals are. So we can't really know if it's been successful or not.
Yeah, it seems that from my experience, at least in Toronto, the local jurisdiction has a lot of power in terms of reducing speed limits and adding speed cameras or red light cameras. And so they have the power to do that, I guess, based on their municipality.
It's true. I think that's an example though, because in Canada and specifically the province of Ontario, public health gets at least a portion of their funding from the municipalities. So just based on the nature of that agreement, there can be crosstalk happening and recommendations can be made, and they might be more inclined to act upon them. But when we get into, like Linda said, the mixed funding, how much of a role does the federal government play on the broader sense in Canada or other countries? I'm not sure. So
yeah, we'll get into a really cool example with Sweden in a second. But I also wanted to just get your thoughts on something I've been thinking about lately. So we've been discussing over this episode and the last episode, the significant burden countries face, especially the low and middle income countries. And, they might not have the same road infrastructure. They may not have access to the same safe vehicles as us, right? And at the same time, compounding these issues are the fact that maybe there are more prevalent issues in terms of what people deem is more important, such as certain diseases that may take priorities in governments or institutions. So my question really is, how do we kind of highlight road safety as an issue that institutions should come up with comprehensive plans with, especially in the context of low and middle income countries where there might be competing priorities?
I think we mentioned it in the previous episode. If the kind of social argument with years of life loss and disability adjusted life years, which meaning that, the productivity that people lose when they sustain kind of a permanent or partial disability and how that affects their productivity. If that's not a good enough argument for policy and decision makers, and considering that there is a finite resources are finite no matter what country you are. So if there's an argument made from the economic sense that the cost savings hopefully spur some action, but the problem with cost savings, and I might botch this because I'm not an economist, but we always talk about the problem in public health is that the dollar is valued more now than it will be valued in terms of cost savings. So while we can make an economic argument for, the economic burden of road traffic deaths, fatalities is $600 billion or whatever it is, the reality is by building a road today, you don't get that back right away. So, when people look at things as just like an investment too, if you have personal finances, if you have to wait longer to reap those benefits, you're less inclined to do so. And it's the same thing when you look at the government investments into public health.
So I think another aspect of that is when we're investing in infrastructure for road development, like for example, speed bumps, etc., there's a lot of wear and tear. So an initial investment for a road safety measure, right? It's not going to have the same lifelong prevention as something else in public health, right? So that road bump you put in, or whatever other measure, it might be gone again.
Or just the roads.
Exactly. Or even just the roads, like there's potholes, etc. That might all just be gone in 5 years. So now you're having that conversation again of, hey, we need you to invest in this again.
Yeah, that's a great point, Ben. Whether like the climate and the weather's impacts, like the longevity of those kinds of things you mentioned. And I just remember in Jamaica, because it's so rainy all the time, they'd fix a road, and by the next year it's gone back to thing. And then we talk about how costly those materials are, and that will influence how long those materials can last. And yeah, that's a great point. It's not like a permanent fix. You have to there's maintenance. How much is the maintenance cost?
Another aspect is the policy window even open to have that conversation again?
Man's getting us all sad, man.
sorry. I'm more optimistic.
Yeah. I was going to say an incentive to get people on board is to show that preventing road traffic injuries and deaths is possible, and it's not an inevitable thing that someone will die or be injured on the road. It is a preventable thing. And so if we can show that, seatbelts works, safe roads works, legislation surrounding drinking and driving, helmets, child restraints, those things can have a positive effect, then perhaps that can gain more support, more momentum. People won't feel like, oh, I can't do anything about this, but actually, wait, we all have a role to play.
Yeah.
In making our roads safer.
Thank you, Linda. You saved the episode. Yes. So yeah, that's a good point. So I think the way we ended up kind of looking at it is roads are bust, right? And what you're saying is it's not roads or bust. There's other things as well that are, you could say, maybe more cost effective in that they don't require this huge investment that can have an impact on saving lives. So that's a great point.
So as I mentioned, we're going to be talking about Sweden, who is recognized worldwide as a global leader in road safety performance. And so with their case, they found that between 1990 and 2015, they were able to reduce the number of road traffic deaths by 66%. So how did they do this, you may be asking? Well, a crucial aspect involved long-term planning, evidence-based approaches to their interventions that they used, and strong institutional delivery and leadership. So what were some of the things that they did? I know they, in October 1997, they adopted something that may be well known in other countries called Vision Zero.
Yeah, so I think simply put, Vision Zero is just kind of systems thinking approach or framework, however you might call it, that focuses on road safety. So we discussed some of the weaknesses of the coordination of leadership and how that kind of serves as a barrier to getting things done in the space of road safety. And Vision Zero simply just puts all the crucial elements together to come together with the optimistic goal of achieving no road traffic fatalities.
Right. So what are some of these aspects Vision Zero kind of encompasses?
So yeah, from a framework perspective, looking at it compared to a traditional approach, well, in a traditional approach, we say that traffic deaths are inevitable, whereas in Vision Zero, they're preventable. In traditional approach, we're assuming that human behavior must be perfect, but in Vision Zero, we account for the human failings in our approach and our strategies.
And another piece of Vision Zero compared to traditional approach is that in a traditional approach, it's very centered on preventing collisions. But in Vision Zero, just like the piece of integrating human failure, we recognize that some collisions might occur, and it's about preventing fatalities and severe injuries from these crashes. And
so more of a harm reduction approach.
More of a, exactly.
Yeah.
More of a harm reduction, systems-based approach to saving lives in a way that is less costly.
I had a question, or I guess a thought to just pose to the group. So Sweden, like, I mean, I've never been to Sweden, although I want to, but notoriously I have that thought, like, oh, Sweden, you know, higher taxes, one of those like Nordic countries, so they pay a lot in taxes. So to me, something like Vision Zero, perhaps they have more capacity to fund it because of just the cultural commitment to, we pay for taxes to help fund social programs or, you know, create better societies. So I was wondering, do you think because of the way their taxation system is set up, perhaps that is why they were able to be more successful in Vision Zero? Because I think it said that they were able to reduce road traffic deaths by 66% over a span of from 1990 to 2015. That's a large increase, and it shows it's successful. But is it because of the way their society is set up already?
I think another piece to that, Linda, to take it one step further, if people are more generally okay with paying higher taxes to get these, you know, programs and initiatives that focus on public health or prevention, the uptake would be higher, right? So if you think of even just road safety education, then I'm not sure what the data is, but maybe they're even then more likely to wear a seatbelt, right? Or less likely to drink and drive because there's kind of that ownership piece that you're saying, Linda, that might help with the uptake and people taking these things more seriously.
Like, we're paying into this.
Right.
And I'm like not here to say, you know, you have to have a high taxation system for this to be effective. But I'm wondering, what do you think in terms of a place where it's set up differently? Could this still be successful?
Exactly. The scalability is like, what about Sweden that made this possible? Is it? It can't be just about seatbelts or drink and driving laws or car seats, because Canada.
It was the institutional management.
Management.
Jeez.
There we go.
No, it's definitely true. Like, if you have your leadership talking about these issues like Vision Zero and having this plan and commitment to the reduction of road-related traffic deaths and injuries, it first of all highlights this as an important issue to the citizens, and so they're more likely to, you know, just be aware of it. And as a result, I guess the ideal would be some sort of behavioral changes, but that's where the institutional commitment comes down to. For example, in Toronto, we see that Mayor John Tory in 2016 announced the plan to reduce the number of people killed and injured in traffic by 20% within a decade. So even though
Targets,
these might
goals.
even though they like, hopefully this is a realistic goal based on the data in Toronto, but to have this commitment and these goals and targets set is a great first step.
Goals are important.
Strong leadership.
What are some of those interventions that are considered best practices that countries and jurisdictions can adopt to reduce these down to the target levels that they've set?
So according to the Global Status Report for Road Safety from WHO, there are kind of 5 risk factors that were highlighted when it comes to traffic deaths and injuries. So basically, having enforcement legislation on these key risk factors are said to be critical components of an integrated strategy to prevent road traffic deaths. So these risk factors are speed, drinking and driving, motorcycle helmet use, the use of seatbelts, and child restraint systems. So now, at this point of our discussion, we're going to go through each ones and kind of have a little discussion on each of these risk factors, starting off with managing speed. So why is speed important to consider, and especially have a legislative policy lens when looking at this issue of speed?
As the signs always say, speed kills. So I think it makes sense. The faster you're going, if you have a collision to something, the less your chance of surviving and escaping without an injury. So addressing speed is an important part of the systems thinking approach to road safety.
Okay, so I think first of all, it's very important to maybe just have a quick discussion on why it's bad to drink and drive.
So obviously alcohol impairs your decision-making abilities and your motor skills. And a lot of driving is hinged on both of those two factors being a key point of not being involved in a collision. So if you're impaired in both aspects, you're basically asking for a collision.
And I think even the response time element of it, right? When you go to driving school or you're practicing for your licensing test, they emphasize defensive driving, right? So part of defensive driving is to anticipate the errors of other drivers and respond in a timely manner to prevent any issues from happening. And if you're impaired, you're less likely to be able to do that effectively. So that's a huge element in terms of preventing death and injuries from collisions, for sure.
Yeah, and I think in terms of policy and legislation, in terms of the best practices, the WHO recommends that you focus or you have a component of any sort of law that looks at your blood alcohol concentrations. So in general, they place a limit for the general population and the young and novice drivers.
Yeah. Why do you think there's different limits for if you're a younger driver compared to an older driver?
I think it has to go with the development of the brain, because we know that the brain is still developing up until you're 25 or around that age. So if you have your driver's license at 16, that's still a number of years before you're, in air quotes, fully developed. So I think that's why they have that distinction between physiology.
So you're saying at the same alcohol or blood alcohol concentration, the younger person will likely be more vulnerable to the effects of alcohol.
Yeah. So that's one factor as well. And there's also the cultural factor of younger people being more riskier with alcohol, as we see in the data. So maybe that's why there's a difference there, and they're trying to make it more preventative for the younger population.
So what are some of, I guess, the key interventions that governments or institutions can kind of use to prevent drink driving from occurring?
Mothers Against Drunk Driving.
Yeah.
MADD. Have some good commercials. Shout out to MADD.
Oh, those commercials, like some of the commercials out there are very,
the one where the glasses keep on stacking on each other
intense.
and they get more blurry.
Effective media campaigns.
Absolutely.
Effective media campaigns. And even you think of even when you go to a bar or even if you go to someone's house, the person or the host or whatever you want to call it can be held liable if the person leaving your event operates a car under the influence of alcohol. So that is that is one of the interventions. So if a bartender, to my knowledge, part of the liquor license is being understanding that not to overserve your clientele, and if they do go out and operate a vehicle and get into an accident, that establishment can be charged. So that's one of those maybe one of the more downstream interventions, but it can be effective if the person serving knows they can be liable. If anything else, people do or don't do things out of fear. So the fear of getting into trouble, even though you should be motivated by doing the right thing, by being altruistic, should drive your decisions. Reality is sometimes fear of consequence is a way to go in a lot of cases.
Okay, so the third one is increasing motorcycle helmet use. So why do you all think that's important?
Motorcycle helmet use, if you look at just motorcycles and if you look at just, cyclists in general wearing helmets when they're wearing a bike. Yeah, we talked about how one of the vulnerable groups of road death fatalities and injuries are people on 2 and 3 wheelers. And we know that the primary cause of death after a collision is a head injury. So it then makes sense that measures to wear some kind of protective thing on your head would be beneficial.
And not to mention the cost savings, because being treated in neuro rehab for a head injury compared to the cost of a helmet, substantial cost saving.
So some of like the key interventions that were recommended were, I guess, laws enforcing wearing helmet, which is very hard to do. I'll get to that in a second. Standards for motorcycle helmets, so the specifications on specific helmets that you wear. Penalties for not using your helmet. And again, like we mentioned for the other risk factors, kind of more informational, educational campaigns that'll help with the awareness
health
of
promotion,
this.
I'm telling you.
Exactly, health promotion. And so that kind of leads me to talking about some of my experiences in Thailand. Even in the main city of Bangkok, where I spent a lot of time, those roads are wild. There's motorcyclists everywhere going in every which direction. A lot of them, and especially their passengers who ride behind them, are not wearing helmets, which is very, very sad. But there has been a lot of progress in this. So in Thailand, they actually passed a helmet wearing law, which basically found that individuals increased the use of helmets by 5-fold. And this resulted, as we all mentioned, a decrease in deaths associated by injuries on bikes.
Question I'm asking about Thailand, but we can open it up to other countries as well.
Yeah.
In order to ride a motorcycle in Thailand, you have to have a license from the government to operate the vehicle.
I'm not sure about that, but from personal experience, it seems that in different areas of Thailand, especially the rural areas, there's not a lot of regulation or enforcement. So it's not uncommon that I've heard of a lot of, younger children riding bikes in their local areas. So,
but the reason I'm asking, so if we look at Canada, and I'm pretty sure the United States, if you're a cyclist, so if you just have a bike and it doesn't have an engine, right? You do not need a formal license to operate it, right? So I'm wondering how the enforcement comes in when you didn't necessarily have to pass some kind of test to show that you're competent to ride a bicycle, as opposed to a motorcycle, which you do need a license to operate legally. So I'm wondering if that makes enforcement more difficult when the vehicle that you're operating to transport is not necessarily, you don't need to be licensed to operate it. And the specific example we're talking about is a motorcycle, wearing a helmet while you're riding a motorcycle, compared to wearing a helmet while you're riding a bike, and you don't necessarily have to have a license to even ride a bike. And then young children ride bikes, right? So we're going to give 8-year-olds tickets.
To give their parents tickets.
yeah.
I support that.
and then we get into the social equity piece with if lower income people are more likely to ride bicycles and can't afford helmets, and you're ticketing those people, there's a social equity issue.
So another risk factor that was mentioned in the report was using seatbelts. And I don't think I have to ask you guys why seatbelts are important, but I'll ask you guys anyways. Why? Why seatbelts?
Yeah. So seatbelts have been shown to reduce the risk of death amongst drivers in the driver and the front seat passenger by up to 50%, and reduce it by 25% from people in the rear seat occupants. So that would be, in terms of when we look at public health and prevention, those numbers are really good. In public health, if you get even a 10% reduction in anything, that's considered pretty good. So considering that you can cut something in half by having a seatbelt policy, that should be extremely desirable.
Yeah, because all of that scales up, right? Because 10% of like millions of people, that's a lot.
Right.
So what we're really talking about here at the end of the day is prevention. We wear these seatbelts to prevent an incident or an adverse incident from happening, to prevent us from flying through the window. And I think, have you guys heard of a huge prevalence of people not wearing seatbelts, like in certain populations?
Oh yeah.
I'm not sure, but
I can give an example.
Go ahead.
This is not to generalize, but my experience in Ghana, wearing seatbelts. I mean, I'd sit in a taxi and I'd be putting on a seatbelt, and they'd look at me like, "Why are you putting on your seatbelt?" Or like it's very sometimes if it, let's say, it's been used for a long time, it can like stain your clothing, the seatbelt, and so often people are like, "Oh, don't wear it. It's dirty, the seatbelt." And so it just depends. I mean, risk perception, it depends what's the norm. It depends the type of vehicle you're in. And so, yeah, it's prevention. But if that's not something you see often, people getting ejected from a car, you may not think the seatbelt is necessary.
Yeah, and another aspect of that in the culture is that you wear a seatbelt, the driver might think, oh, you think I'm a bad driver? You think we're going to get into a
Exactly.
collision? It's insulting.
Exactly.
So you're like,
just got offended.
And they ask you.
Yeah, straight up, they'll ask you like, why? What do you think is going to happen? Why are you wearing your seatbelt?
And that goes back to your earlier point, Linda, too, about motivation. So we're motivated to follow the speed limits because we don't want to get pulled over. And unfortunately, too, in a lot of cases with the seatbelt, it's, oh crap, I just passed the police and I don't have my seatbelt on, right? So it's unfortunately not motivated by preventing severe injuries and death. It's motivated by not being penalized, unfortunately.
But that's true with all aspects of road traffic, really.
Not really. I think that the helmet one's an interesting example, right? It's I mean, you can kind of, I mean, if a helmet, if there's no laws to wear a helmet and you're wearing a helmet, it must mean that you recognize the value of a helmet.
Yeah.
Right. So
I mean, I think like part of it is motivated by your safety and others, but like it's maybe not as much of a priority as you not wanting to get a penalty.
Right.
So,
right.
So it's there, but it's maybe
that's good because we have that, what's it called? The intervention ladder where
the Nuffield or Newfield intervention ladder. So at the base of the ladder, and it's just you do nothing or you simply monitor the current situation, and then it goes up vertically on the levels of intervention. So it goes from doing nothing to providing information. Then you enable choice. Then you offer a guided choice through changing the default. So for making healthier choices the default option. And then the step above that is a guided choice through incentives. So you use financial or other incentives to guide people to pursue certain activities. So this comes to mind like when you give people money for recycling. And then
another example too is if you don't have any collisions on your car insurance, then you can get like a rebate. Yeah,
a relatable example. To road traffic. And then above that is choice through disincentive. So like a speeding ticket, to influence people to not pursue a certain activity. And then above that is restricting choice, where you regulate to restrict the options available. And then the very last choice, so at the highest top part of the ladder, is to eliminate choice, where you regulate to eliminate a choice entirely. And this all comes from the Newfield Council on Bioethics.
I'm glad you brought it up, Linda, because in the World Health Organization report that we're referencing throughout this discussion, they consistently indicated that typically stronger measures are more effective. And as we go up that policy ladder that you mentioned, when there's no alternatives, people are more likely to follow because they're motivated by having healthier behaviors, or they're motivated by avoiding punishment. So that's a good point.
Right.
So with that in mind, let's head on to the last risk factor, which is child restraint use. So what we know from the literature is that child restraints are highly effective in reducing injury and death to child occupants. And the use of these restraints actually lead to a reduction of around 60% in deaths. So what are some of these, I guess, laws that the WHO recommends to implement in different countries?
What I found really interesting from this is that the WHO recommends best practice is to have child restraint in place until the child is 10 years old or 135 centimeters in height. But in Canada, we do not enforce that. And
I was shocked too, man.
Yeah. And I saw this and I was like, I know I was not in a booster seat until 10 years old. I wasn't.
10. Wow.
And but in Alberta anyway, it's a recommendation, but it's not law. And so when people hear that, how many of us are even aware that this recommendation is in place until 10 years old? And if you hear recommendation versus an enforced law, how do you perceive the necessity?
A fine versus a no fine.
Yeah. Or let's say you can't afford a booster seat. They're not cheap.
Exactly.
I thought it was interesting. I didn't know this at all.
But even you think of the example, and I think going back to your examples of being in taxis when you're in Ghana, and similar experience for me when I'm in Jamaica. First of all, cars have a limit to the amount of passengers it can have. Oftentimes in certain countries, you end up with maybe 3 or 4 more people than you should have in your car, right? So
way more in some cases.
Sure, I'm just being right. So
one the trunk,
on the roof.
Yeah. So cars, right? So vehicles are built with the number of seatbelts that you need for the number of passengers that should be in your car. So if you go beyond that, you can't have seatbelts. And in the example with the child restraints or the child car seats, if you're having, and my experience in Jamaica too, when my parents were carrying me around and maybe they've had to use taxis, if the taxi driver needs to pick up 7 people in his mid-sized sedan, you can't take up 2 seats with a car seat. That's going to infringe upon his the return on investment, so to speak, of what his trips that he makes, right? So if you look at it too in those developing countries where the gig economy or the informal work sector, where people rely on that form of transport to bring income to their family, you're not really willing to sacrifice 2 spots in your car to have 1 child in a car seat.
So is this profit over people, or like, and not to bash people, but it's like, this is the society we've created.
Yeah. I mean, but then it goes, I think in terms of the social determinants of health, I think this is one where you just have to go more upstream to, they're doing it for economic well-being, maybe, that the economic part of it has to be addressed rather than you shouldn't have a child not in a car seat in your car.
So we wrapped up on talking about these 5 different risk factors, but there are different considerations that go beyond this that the WHO did also recommend to look into. So one of those are reducing distracted driving, and we know
cell phones.
With the increase of cell phone use and accessibility, more drivers, especially young and novice drivers, are being distracted by their phones, texting while driving, calling people while driving, FaceTiming while driving,
FaceTiming.
So, yeah. Why is this a concern?
Yeah, distracted driving increases the chance, just like being impaired while driving, whether it's, we didn't really talk too much about cannabis in Canada and how that has changed the game for enforcing laws of drivers being impaired and such and such. Yeah, that's definitely a factor.
But that's a hefty fine in Alberta anyway, if you're driving and you get caught using your phone.
Yeah.
I think it's almost $300 plus demerit points.
Jeez.
Well deserved.
Oof.
Do you think that's well deserved?
Yeah, it's a deterrent.
It needs to be even more.
Yeah, it could be more. I think the problem is in terms of the effectiveness of it. Of the people that actually do it, maybe 10% of them are caught by police. Is limited capacity, right? So it's more sustainable to maybe the health promotion side of it to just communicate that it's just not a good idea and maybe make healthier choices easier choice. So with that said, the point of public health is to create supportive environments for people to feel their potential to be healthy. Another thing is to reduce the number of preventable deaths. And if technology has a role to play, where the reality is cell phones and that kind of social media connection has become a fabric of our society now, it's going to stay here for the foreseeable future. And it's about building an environment around that to make people safe while they're driving.
So we have discussed the importance of institutional management and leadership, along with interventions and the ideas from a legislative perspective to reduce the burden of road traffic deaths and injuries. Remember to always wear your seatbelts and obey your local traffic laws. Stay safe.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.